Dr. Alan Prescott was a man whose name commanded respect across boardrooms and healthcare summits. With silver hair, a soothing baritone voice, and a history of academic excellence, he embodied the image of integrity and innovation. Known for his philanthropy, donating MRI machines to underfunded hospitals, launching rural vaccination drives, and speaking at TEDx events, he was hailed as a savior of American healthcare. But underneath this image was a meticulously hidden empire of deception. Prescott Care, the healthcare conglomerate he built, was involved in one of the most elaborate Medicare and Medicaid fraud schemes in modern U.S. history. Prescott's empire was built not only on medical services but also on data, millions of records fed into proprietary billing algorithms that manipulated insurance codes for profit. Behind closed doors in his Kansas City headquarters, floors were segmented into specialized fraud operations. One focused on fake telehealth sessions, another on ghost lab results, and a third on identity farming. Employees were lured with six-figure salaries and bonuses tied to claim density. Prescott's right-hand man, Marcus Hale, was a former DOJ compliance officer who helped reverse-engineer audit protocols to evade detection. Marla Chen, a young and underutilized investigative journalist at the Kansas City Star, was still recovering from a previous exposé that had been squashed by corporate pressure. Her career had stalled, but her instincts remained sharp. She received an anonymous tip in the mail, no return address, only a USB stick with a single file named start_here.pdf. Inside were logs of suspicious billing records and one cryptic line, "Follow the redline patient, Victor Mendez." Victor Mendez had once been a loyal Prescott Care data analyst. A reserved man in his late 30s, he lived quietly in a modest apartment with a view of the Missouri River. But Victor had an exceptional talent for pattern recognition, and when he was transferred to the claims optimization department, the data began to disturb him. Patients were being billed for services they never received. Some were treated posthumously. Others, like his own aunt, had been billed for experimental therapy while bedridden at home. Victor started documenting everything: logs, emails, altered billing code manuals, and fake physician rosters. He tried to raise concerns internally but was stonewalled. He sent a preliminary report to the Centers for Medicare and Medicaid Services, CMS, but it disappeared into bureaucratic limbo. On a rainy Thursday night, Victor disappeared. His apartment showed no signs of forced entry, but his laptop, encrypted hard drives, and a hidden flash drive in the smoke detector were all missing. The only clue left behind was a sticky note on his fridge: "Prescott knows. Watch the Georgia Loop." Detective Carl Hunt, a grizzled homicide investigator with a penchant for conspiracy theories, was assigned the case. The official line was suicide or self-exile, but Carl wasn't convinced. He discovered that a surveillance camera across the street had been disabled the night Victor vanished. A neighbor recalled seeing a black Ford Explorer with government contractor plates parked outside for 3 nights prior. Something smelled wrong. Marla Chen, fueled by curiosity and haunted by the memory of her career's derailment, decided to follow the lead. Victor Mendez's name led her to records that didn't match. She pulled his patient logs and compared them to CMS filings, over 200 appointments in 2022 alone, many while he was working at Prescott Care. The implications were staggering. Prescott Care's legitimacy was meticulously curated. Offices were set up inside repurposed schools, old post offices, and even RV units, places that wouldn't attract federal inspection. The organization ran a community engagement team whose job was to create buzz through sponsored local events and free mobile health fairs. These fairs collected data that would later be exploited for ghost billing. Marla tracked several clinics supposedly active and serving thousands. Instead, she finds shuttered buildings with no signage. One clinic in Harrisonville was actually a warehouse leased by a janitorial company. The staff listed on Prescott Care's website included fabricated personas with AI-generated faces. Internal IT logs show these personas were cycled every 90 days to avoid detection. Elite Med Labs in South Carolina, owned by Dr. Francis Harwood, billed Medicare $43 million over 18 months for complex cancer panels that never left the lab. Harwood was an eccentric biotech startup investor whose prior ventures included failed genomics apps. His collaboration with Prescott allowed both men to boost revenues by rerouting lab orders through Elite Med's automated billing network. Harwood's employees were ordered to bulk run fake tests based on Excel uploads sent from Prescott's main server. A terminated lab tech, under oath, reveals they would run barcodes on empty vials just to register patient data. Investigators eventually uncover a set of internal guides titled, Claim Stacking 101, and Making Non-Essentials Look Essential. The fraudulent structure was genius in its architecture. Real patients were lured in through free health screenings, and their insurance data was quietly cloned and replicated. Others were completely fabricated, digital humans with convincing backstories, photos, and partial identities pulled from Social Security databases. A review of patient logs reveals instances of people being treated for 8-hour inpatient therapy sessions while actually attending church, school, or being hospitalized elsewhere. Marla discovers that even prisoners were unknowingly used as patients. A correctional officer confirms dozens of inmates' Medicare data was extracted through an education program run by Prescott Care. The scale of exploitation shocks even seasoned auditors. Rachel Levinson's audit hits a bureaucratic wall. She compiles a 256-page report titled, Projected Cost of Ghost Billing Schemes, but her manager advises her to delay submission due to political sensitivities. She soon learns that Prescott Care made $1.8 million in donations to a national PAC supporting healthcare deregulation. Rachel leaks partial findings to a DOJ contact under an alias. Meanwhile, she uncovers GPS data showing doctors billing from 2 different states within a 15-minute window. Internal chat logs refer to a time shift protocol that allowed tech teams to alter timestamps for better claim approval rates. In Georgia, a forensic investigation into pandemic unemployment fraud links over 300 claims to Prescott-affiliated addresses. Each name was tied to fake job titles like Health Technology Scout or Wellness Logistics Officer. These same identities appeared as patients in Prescott Care billing records. A regional banker blows the whistle after noticing deposits from federal relief programs funneled through ghost accounts tied to inactive phone numbers and P.O. boxes. Law enforcement raids a house in Savannah, discovering walls lined with SIM cards and routers rerouting traffic through Eastern Europe. The fraud extends far beyond healthcare, touching unemployment systems, tax credit programs, and even grant applications. Victor's backup storage includes audio recordings of board meetings where senior staff discuss revenue enhancement through advanced data modeling. In one clip, Prescott says, "If they're already sick, Medicare will pay. If they're dead, we just have to be faster than the obituaries." Rachel and Marla jointly verify metadata on documents revealing a command center within Prescott Care that managed risk exposure using predictive audits, flagging which accounts were safe to overbill and which ones required silence. Victor had developed the original redline_ protocol to audit ethics compliance. Prescott's team turned it into a fraud blueprint. Federal agents execute 31 coordinated raids, including facilities in Baltimore and Nashville that were registered as mail forwarding labs. Drones capture footage of executives fleeing through back exits, while forensic accountants freeze over 300 bank accounts. In one Prescott office, agents discover a hidden vault with confidential government contracts, private investigator dossiers on potential whistleblowers, and cryptocurrency ledgers. Marla's reporting is live-streamed by international news outlets. Rachel uses her internal access to expedite federal RICO charges, combining evidence from multiple departments into a unified indictment. The FBI confirms it's the largest healthcare fraud takedown in U.S. history. Prescott's final days of freedom are marked by erratic behavior. He attempts to transfer $80 million in crypto to a foreign wallet but is tracked through blockchain analysis. When arrested, he is wearing a custom-made vest embedded with signal jammers. In custody, he attempts to pin the operation on Harwood and lower staff, but his own digital voice memos betray him. DOJ releases a 640-page indictment citing racketeering, healthcare fraud, money laundering, identity theft, and obstruction of justice. A psychiatric evaluation finds him competent but narcissistically delusional. A second grand jury is convened to explore further conspiracies. Harwood's downfall is swifter. Caught on CCTV attempting to destroy lab files, he tries to fake a heart attack in custody. Plea negotiations begin within 24 hours. In exchange for reduced sentencing, Harwood hands over emails implicating high-level Prescott care advisors, including 2 former state health officials. His testimony outlines how Sapphire Loop could manipulate predictive billing engines by identifying untapped diagnostic gaps in regional Medicare trends. Harwood claims they were preparing a new system, Diamond Eye, capable of scraping biometric data from wearables. Marla's coverage becomes a Netflix docuseries. She publishes White Lies and Blue Scrubs, a bestseller detailing the scandal's origin, rise, and fall. She declines a lucrative book deal that required softening her tone on federal regulatory failures. After receiving threats, she's placed under temporary FBI protection. Her columns are translated into 11 languages and become case studies in journalism schools. In a packed lecture at Columbia University, she tells students, the truth isn't hidden. It's buried under convenience. In a federal courthouse transformed for high-security proceedings, hundreds of hours of evidence are presented. Victims speak of delayed surgeries, rejected claims, and psychological damage. Prescott's defense team attempts to introduce AI-generated counter-evidence but is blocked by court forensics. The jury listens to manipulated audio tapes where Prescott practiced victim-blaming strategies. Prosecutors draw parallels to pharmaceutical scandals and Wall Street fraud. Social media erupts daily as new connections are revealed, including ties to foreign investors and data brokerages. The courtroom becomes a national stage for healthcare accountability. Prescott is convicted on all 34 charges. Harwood and 4 executives enter plea deals. The final sentence includes a 38-year term, a $312 million restitution order, and lifetime ban from the healthcare industry. The court mandates that whistleblower families receive a portion of the recovered funds. A congressional subcommittee begins drafting new guidelines on data ethics in healthcare. Several senators quietly resign. Congress enacts the Victor Mendez Health Integrity Act, requiring real-time claim verification, biometric data consent logs, and AI bias detection in predictive billing. Rachel Levinson is appointed to lead a new federal office overseeing medical data integrity. Marla returns to Kansas City, where she opens a nonprofit newsroom focused on public fraud reporting. At a ceremony held in Washington, Victor's mother lights a commemorative lantern as lawmakers read his final email aloud. The words echo across chambers, "It's not about stopping fraud. It's about remembering who they hurt." The scandal forever changes how America views healthcare, and who it truly serves.